Yeah, we're really talking about the flu this morning because 19 states have now reported high levels of flu activity. So, Dr. Don, tell us what we need to know in terms of how this impacts our kids and what we need to be aware of.
Well, February is not just Super Bowl and Valentine's Day. It's actually the month where the flu season gets nasty. So January, February, March, the flu season extends into May. So now we're getting into the fact that the flu, even though King County and the state of Washington only have local flu season here, it's very mild so far, even though there's isolated cases. What we're talking about is the flu virus is only a plane ride away. So that states that have widespread flu can bring it here. So what we need to know is if you haven't had your Band-Aid yet, we want you to get your Band-Aid. It's never too late to get a flu shot. And again, there's some numbers. 2 to 3 feet, that's the distance that we are today, is going to be the distance that flu virus can affect, and it can affect, if you're coughing or sneezing, up to 15 to 20 feet away. So
really?
That's a heavy sneeze.
That's a heavy sneeze. So we're all under the auspices of having this flu virus affect us if we're near someone that has the flu. And 24 to 48 hours, that's the key factor in that the flu virus is silent. We are carriers of a flu virus and spreading it for 24 to 48 hours before we get the symptoms of headache, low-grade or high-grade fever, and cough.
The worst.
So you can spread it and not even know it.
You can spread it and be a silent carrier. That's correct.
So the flu shot, not 100%, right? Very close. We've come a long way. So what are some of the other things we should be doing to make sure we're safe?
Well, the flu shot this year is going to be a little more effective because the flu virus that they are isolating is a little bit more, shall we say, likely to be the vaccine virus that we have in the vaccine. Good. So it's going to be more protective this year. At least that's the theory from the CDC. What we should be doing now is making sure that if you don't have your flu shot, get it. If you don't have your children get their flu shots, get them. Relatives that come up, again, relatives, caregivers of kids under 6 months, have to get it. Pregnant women, there's a lot of people with medical conditions. So again, talk to your doctor, talk to your pediatrician about whether you should get the flu shot. Pharmacies, doctor's office, they all have it. And one is better than none, even though kids from 6 months to 9 years need 2 shots to be effectively protected.
What about the flu mist? Is that as effective as the shot?
The flu mist, again, this year is new. They're theorizing it could be more effective, but it's very difficult to find. So if your child is really afraid of getting the shots and you have a chance to get the flu mist, we're actually saying to you, one is better than none. But the American Academy of Pediatrics is not recommending that children get the flu mist this year because it's just too early to tell if it's going to be effective. The vaccine killed. You cannot get the flu from the vaccine. So that's a misconception.
Right. That's a myth.
But you can, I personally have experienced where I get the flu shot and then I get a little sick afterwards. I didn't get the flu, but what causes that after you get a flu shot?
Good question.
Well, again, your immune system is now taking 10 to 14 days. The flu shot is not immediately effective, so it takes 10 to 14 days for it to take effect. So a lot of times if you're harboring other viruses while your immune system is coping with the fact that it has to now be paying attention to the flu virus and getting antibodies to that, some of the other viruses can leak through and make you a little bit sick. So usually the big side effects are just a little soreness or redness.
Okay, good. Here's one for you, too. So what do you say to people who may say, I'm not getting a flu shot, I don't believe in flu shots, it's not going to help me for whatever reason or the other? How do you respond to that without creating just tension?
Well, you could go to the dark side and say that there was 80,000 deaths and 180 kids that died last year. 50% of those kids were healthy children before with no medical conditions. So you could go to the dark side, or you could go to the side where it's logical. The reason we wear seatbelts and have airbags is not because we're not safe drivers. It's because someone's going to crash into us and injure us. And that's the same theory about the flu. You can be healthy, but somebody who is unhealthy within 2 to 3 feet, silent carrier, is going to pass the flu to you. And believe it or not, your system, we are still not sure genetically why some people get the flu when they're healthy and some people don't. So again, it's like Clint Eastwood in the wonderful movies, the Dirty Harry movies. Are you feeling lucky? I hope not. So again, everybody get their Band-Aid.
All right,
Dr. Don Shifrin, thank you so much for all your input and advice.
Great to
see
be
you in a few
with
weeks then.
I hope so.
Yeah.
All right.
Okay.
Thanks, Doc.